the Montana State Health Conference, and I'm not sure what the title of that conference was, in Helena in September. They asked me to come and speak about the history of the Butte Health Department, which I was delighted to do because it is the premier health department in the state of Montana, and it is 30 years older than the state health authority. And that's pretty impressive in a state that is as young as the state of Montana. So I was invited, and Ellen Bondler was invited to talk about the history of disease in the state of Montana. She talked about people who had rare, very rare diseases. I had about 7 people. I think she had 2. History is not something health authorities are interested in. So, okay, thank you. So I want to start by saying, Butte really was established very early in 1864. And the people that had come to this community at that time had come fresh off the Civil War battlefields. And that made a difference in how they looked at the establishment of communities and governments. They knew a variety of things to do and a variety of things not to do. So the city grew very, very fast, from 1864 to 1890. 1864, 100 people here. 1890, almost 70,000 people were living in Butte. So city planners and early sort of public officials brought a great deal of experience from eastern cities to bear on establishing our government. And the documents that we have from that time are absolutely incredible. So one of the key people who established our government was O.Dillon Whitford. He was a doctor, Dr. O.Dillon Whitford. He also was a mining investor. And he was an interesting man because he played a big role in the establishment of the health department. So at the time that Butte was laying its foundation, he was a city alderman, and health played a big role in those early documents. It also, nationwide, was a time of sanitary reform. And sanitary reform really made a big difference in places like New York City, where you had a million people. But when you have a small community establishing sanitary reform measures at the beginning, it really makes a difference on how the quality of people's lives would move forward. So here we are, 1876. And early in 1879, a health ordinance was passed. The health officer was appointed, and that is a full 30 years before the state of Montana established their health ordinance. The key to a good health ordinance is having a police officer enforce it. Amazing. Come on in. The city fathers appointed one officer to enforce all rules of the health ordinance. And they would enforce all of the objectives of sanitary reform. Improved sewage control. They would form a health board. They would inspect all public facilities. They would provide clean drinking water. They would quarantine the sick and contagious. They would provide food inspections and the proper handling of the dead. Now, for those who work in the health department here, these are tasks that I'm sure you are enforcing today. This is Ordinance 306, and it was to be implemented by the health department. It was overseen by the County Board of Health and enforced by the city marshal. It called for the protection of public health. It has 55 sections. All of those public facilities, schools, restaurants, hotels, boarding houses, dairies, butcher shops, would be inspected monthly. All sick and contagious would be quarantined. The health officer was to maintain this volume of who was quarantined and for how long, and who was their physician. These documents are absolutely incredible. This book and this section of this book deals with scarlet fever. Each volume is broken down by disease. And once you get into these pages, you can see the patient's name, their age, their place of origin, their color, their gender, their disease, when they are quarantined and when they're released from quarantine. These volumes are just exceptional for academics. They have used this to map disease, to determine what sections of a community may need better sanitary treatment. They have used this to determine if people of immigrant populations were getting diseases and dying of them at a different rate than people from other parts of this country or other nations. These books have provided some marvelous, marvelous documentation. And look at that wonderful handwriting. The Board of Health was required to keep detailed records of all births and deaths and contagious diseases. In this country, it was not a law to register a birth until the 1960s. The birth records that we have begin in the 1890s. Why do we have so many births when it wasn't a law? The health department paid the doctors a nickel for every birth they would register. Well, you know, that was a great incentive. So they wanted information on those births. What number of child was that to the mother? Was it a live birth or was it a stillbirth? Tell us about the health of those people. Where are they from? Where's that mother from? Where's the father from? What are those occupations of those people? These documents are incredible. They're in big volumes like that contagious disease volume, and it is a wonderful source of genealogical information, but it is also a wonderful source of vital statistics in a very young city. So you see here this letter from 1890. 219 certificates were returned, and a total of $10.95 was paid out to various physicians. That must have been their fun money. Our birth records are some of the best in the state of Montana and probably some of the best in the country. The vital statistics alone are wonderful. So, a series of rules in that health ordinance about the handling of the dead and bodies and permitting for the transportation for burials and to move bodies from one place to the other. That ordinance outlines every disease that someone would die from, and if they died of something like smallpox, what had to happen with their belongings, who touched them, how they would be handled. It was an incredibly detailed section of that ordinance. Yellow fever, typhoid fever, and scarlet fever, everything had to be burned. And the health department was pretty good about keeping on top of those things. The health officer was required to inspect food and animals and police garbage removal. It called for the inspection of dairies and food preparation facilities like this meatpacking plant, that meatpacking plant. This was no small task because there were 40 meat markets, 10 meat packing plants, 33 dairies, and 84 groceries, not to mention the 54 restaurants and more saloons than you could count. And all of those required the health department to check on that. Those records are very interesting. You can tell a lot about a society when you look at those records. So here is the other task the health department was ordained to do. They had to collect money from all of the physicians that were practicing medicine. They also had to get the permit of scavengers, funeral directors, purveyors of food, milk, and animals. And I love this document here because Dr. Gunn was the health officer, and he paid $1.65 for his permit. That's one of the highest permit fees assessed. I thought that was interesting that he's in there as pay. Dr. Whitford paid 10 cents. The sanitary policeman fined individuals and businesses and collected the fines, and he enforced all 55 sections of the Health Ordinance. Some of the best documents that we hold in our facility are the mortuary reports. This is a very early report, 1893. Look at the presentation of this report in 1893. It's printed at a printer. It is an incredible series of documents that can tell you a great deal about the city that we live in. They're very formal documents. They're submitted to the Council of Commissioners, or at that time the city alderman, and the Council of Commissioners. Because the health department served the entire community, they worked for both those governments. This report states that in 1893 there were 504 deaths. 313 were women, 313 were men, 191 were women. Of those 504 deaths, 257 were children under the age of 20. 257 children. Wow, in a year. 493 of them were white, 5 were colored, 6 were Chinese. 361 were single, 104 married, there were 14 widowers, 10 widowers, 14 widows. The occupations of those deceased are listed as gambler, dressmaker, cigar maker, shoemaker, nurse, butcher, corn doctors. That's a foot doctor. I love that. There were the usual miners, smelter workers, carpenters, machinists, and of course laborers. Respiratory and lung disease took most of those lives at 123 deaths. Contagious diseases were second with 116 deaths. And those diseases were like cholera, measles, scarlet fever, typhoid, chickenpox, and of course smallpox. An amazing report. Think of all of the information you can gather from that. The meat and milk inspector. This is a great letter. The food and meat inspectors documented every visit that they made. If they were requiring that a business destroy the food because it was unfit for human consumption, they followed up. They wrote detailed reports. They fined those people. This 1911 report of the meat and milk inspector, it documents his total workload. He inspected 33 meat markets. He found few with any infractions. However, he inspected 3 slaughterhouses, found 2 good, 1 not at all sanitary. Few of the dairies passed inspection in 1911. Few of the dairies. He says that the dairymen know nothing about sanitation. Now, I think that's interesting. All of the dairies would be in Browns Gulch, they would be in Elk Park, they would be down at the 9 Mile area in Basin Creek, almost all of them Italian. I wondered if there was a little prejudice there. I want to talk for a few moments about Dr. Whitford. He was the first health officer. He was a graduate of the Eclectic Institute of Medicine in Cincinnati, Ohio. He graduated in 1858 and began his journey west. He practiced medicine from place to place. He invested in mining ventures. When he got to Butte, he stopped. He immediately established the health committee. He served as a city alderman. He ran for the office of the mayor and in 1881 was elected. That moved him from a lower level of influence into a very high level of influence, and the health of the community became top priority. Ritford opened a miners' hospital on the corner of Idaho and Galena Streets. That hospital was also served as drug and alcohol treatment at a time where that wasn't even on the, on anyone's map, because it was 1890. The Eclectic Institute of Medicine was really more homeopathic than scientific at that time. Whitford, however, was a very good doctor. He waged a campaign against smallpox. He pushed for very strong enforcement of Health Ordinance. He quarantined the sick at a rate none of the other health officers did. He made the treatment of disease and sanitation in Butte his top priority. He admonished the Health Commission with all facets of quarantining of the victims. He demanded that homes where people were sick with smallpox, scarlet fever, would be sanitized. He sent a police officer and a cleaning person there. He called for the mandatory vaccination of all people within the city for smallpox, at a time where I didn't realize there was a vaccine for smallpox. He authorized the hiring of more policemen to enforce this mandate. He felt that smallpox was the greatest scourge at the time. If you're ever walking through a cemetery, you will see, row after row of people dying in 1905. And you come here and find that they died of smallpox. This is unheard of today. We get vaccinated, hopefully. Smallpox also had a tremendous cost to the city government. Even though he was diligent in the quarantining, he demanded everything get burnt. The cost of smallpox was huge. In 1900, this document shows that there were 166 cases of smallpox, and 4 of them died. The county bill for the treatment of those smallpox victims was over $6,000 in 1900. That is a huge bill. Whitford had such an unusual approach to health care with his enforcement of using homeopathic methods rather than some of the more difficult at the time scientific treatments. But it was hugely successful, and he had a great practice. People were lined up to see him. However, he was not very well respected amongst his peers. They felt that his methods were unusual, but his biggest problem was he was an atheist. And in a city like this, that atheism didn't quite carry too well. So his other professionals felt they would never talk about his religion, but they kind of were nasty about his non-traditional practices, which I thought was really wonderful, because really when you look at the establishment of the health department and that ordinance and the components of it and how it followed the sanitary reform movement, he was really pretty impressive. By the time sanitary reform really reached its height in the rest of the nation, we had it already under our belt here. It was really pretty great. The progressive policies really can be reflected in the health department. The health committee that was formed at the very beginning had a whole new respect in the community, and it made improving the lives of community people its top priority. And also started to look at the people who were living at the edges of our society and how to bring them in and be sure that they were well cared for. The health department not only addressed Sanitation issues, quarantines, mortality and vital statistics, as well as all of the meat and milk inspections. It began in 1900 making noise regarding environmental issues. And if we look at the noise, the smoke nuisance, when I looked at this particular nuisance, it is full in the minutes of the health department. They began meeting on this monthly, dealing strictly with smoke. Dr. Robarts was the health officer at the time, and he believed that smoke pollution was having a negative effect on the health of citizens. The smoke issue came about from heap roasting sulfide ores. The ore in our ground here is very high in sulfides, and you have to burn that off before you could start processing it. In the 1870s and 1880s, they would build heap roast smelters. And I don't know if any of you know how that worked, is they would take an area about the size of a city block, or timber, until it was about 2 stories high, and then they would torch it. And there was no stack or flume or anything, it was just open. And it would burn off the sulfides. This created this huge smoke issue in our community. And it wasn't just one mining company, it was all of them. So you might have 10 of these heap roasts going on at the same time. We all live here, we know what happens here in the winter. We would get those inversions and the smoke would limit down to the ground and people couldn't see it so much as a foot in front of them. So as the health department, Dr. Robarts started to raise Cain about this, and the papers were covering this issue of the smoke. Clark, William A. Clark, what a good guy. He responded by saying, the ladies of Butte love that. Gives their little cheeks a rosy glow. It was not an easy fight for the health department. It was incredibly unpopular to go against the corporation. It was difficult for them to make any headway. They started raising Cain about this in 1900. Took until 1906 to get it really resolved. Robarts noted in 1890 there were 192 deaths reported that he believed were exacerbated by smoke. In December alone of that year, 36 deaths were attributed to the complications of smoke. The smoke contained arsenic, sulfide, and particulates. Dr. Robarts believed that there was a direct relationship between smoke and respiratory illness in Butte, and many of those deaths were from respiratory failure. Robarts took on City Hall and the mining companies about heap roast practices. Robarts' campaign saw the passage of the Smoke Ordinance, which called for the end of heap roast smelting. He only got a 3-mile radius. Outside of that 3 miles, they could burn it. But finally, by 1915, all smelting was out of here. It's interesting to me, the health department still monitors smoke in this community. They're still out there measuring smoke, mostly of it wood smoke, but they're also monitoring dust and other particulates in our air. 1900, 2018. The health department began monitoring well water in Silverbow Creek and near Silverbow Creek as early as 1890. There were a number of trash dumps that were established at the banks of Silverbow Creek very early in the 1870s, and the well water started showing up bad, so they started cleaning that up and moving that out. Dr. Robarts also felt that what was flowing in that water should really be understood. So he started to test for metals. 1890, 2018, I believe the health department still monitors wells near Silverbow Creek. With the acknowledgement of these environmental hazards, the smelting, and having won the smoke wars over time, the health department took on a single most significant cause of death in our community, tuberculosis. The cost of the production of a pound of copper should at all times be secondary to the cost of human life. Carl Horst, MD. He's my favorite. The disease was addressed in a very aggressive way by Dr. Horst. He was no stranger to mining or mining communities, and no stranger to respiratory diseases that came with them. He was born in Virginia City, Nevada. In 1876, his father, a physician in Nevada, sent Dr. Horst to a brand new college in California, Stanford. Yes, Horst was one of the first in his graduating class, and it was the first graduating class of Stanford. Horst went on to study medicine at Johns Hopkins University. He returned to Butte and went into practice with his father. He became the health officer in 1911. After nearly 5 years as a health officer, Dr. Carl Horst made the most significant improvements in the health of our citizens. He called for all public schools to be inspected again. He demanded that all policemen be given a physical with great deals of detail collected on them, their height, their weight, distinguishing characteristics, and most importantly, if they suffered from any diseases or deformities. A lot of times when people would get really sick in the mines, they would be really compromised by respiratory disease. They'd go to work as a police officer. They could not catch anything. They probably couldn't catch anybody in a pen. They would be so sick. I think this was really interesting that he had raised the level of that kind of health of people who were really there to take care of citizens. He ensured that the data would be provided to the decision makers in the community and to ensure that police officers were really fit. His most impressive effort was his war against pulmonary tuberculosis from 1913 to 1915. He took this on single-handedly. The health department, as the chief of the health department, he took on the Anaconda Company about this. In 1913, he sends a letter to the Anaconda Company president accusing him of genocide. Of the number of genocide, yeah, uses that term. Men suffering from tuberculosis, he said, was just criminal. And that they would persist in working underground. Other physicians would let miners go back to work. They would say, yes, you've got a cough, you'll be fine, go back to work. They'd go back to work and get sicker and sicker and sicker until they, 35, 40 years old, could not work any longer. So he felt that when people were first showing symptoms, that they should be advised to leave mining. That didn't go over well with miners organizations, the Anaconda Company, no one. However, he really was looking out for the best interests of those people. The study of the mortuary reports from 1900 to 1919 show that nearly 1 man per day died of tuberculosis or silicosis. 1 man a day. That is a greater rate than they had mining accidents, which that was 1 man a week. Mining was really devastating to men's health. What happened there was you had 1 man a day dead, leaving a wife and 5 to 7 children, with very limited economic opportunities for that woman. Yes, so when those boys tell you that they sold newspapers, women sold eggs, they took in laundry, they made buckets, girls went to work at 14, 15 in boarding houses, it was tough. It was hard for them. Horst had many achievements as the health officer. He limited alcohol in the red light district. He also required that women in the red light district have hot and cold running water and sanitary wash basins in their rooms. This had a dramatic impact on the health of everyone in the community. And the drop in sexually transmitted disease after that one little thing made a huge difference in our community. He installed uniform trash bins at every household and that reduced litter and improved the sanitation of the city immensely. He saw new sewers constructed in some of the poorest and most compromised sections of Butte. And he made improvements at the emergency hospital. He was really an impressive manager of the health of our community. I don't think that any documents that we hold are as great as the daily documents of the health department during the Spanish influenza pandemic. Beginning in October of 1918, the health department met every single day. With respiratory illnesses being one of the major health factors in our community, people were dying of pneumonia, and the health department was trying to determine what was going on. Is it just a respiratory illness from all of the mining issues, or is something more going on? So the very first cases were kind of put into the mining category. But the minute that they realized that they had the flu on their hands, they immediately closed theaters, schools, pool halls, churches. Funerals were held, but they had to be private. You could not have more than 1 or 2 people there, no congregating on the street, no spitting on the street, no sweeping your porch. Over 1,000 people are lost by the influenza in our community, and that really isn't very many when you think about, the numbers that were lost in the world. It is a marvelous response to an illness that the health department made. It was just really impressive. And they got volunteers to help the treatment of the sick. They took the Washington School because it was closed. They made a little hospital in there. They got patients in the households. It was really great. And every day they documented the number sick, the number dead, the number of actions that were taken, the number of people who were arrested for spitting on the street. It really is, it's like, oh, wow, very cool. When I look at the health department, I talk about this early time because it was so impressive to watch how they managed. I then had to stop because I couldn't talk for two or 3 hours. So I'm going to talk about decades now. So from 1918 through the 20s, the health department continues to meet its mission that was outlined in the very first ordinance. They call for the public support in keeping flies and pests under control. There are advertisements everywhere in the newspaper. They're really cute. They ask for wives to get screen doors, to put screens in their windows, keeping their yards and kitchens clean. The department publishes the dairy inspections and meat inspections in the paper and advise housewives where to purchase their meat or who's not got good meat. They maintain good health practices, and over the next 100 years, they address a variety of health issues, and you're going to hear about them by the decade now. From 1920 to 1930, there is a strong emphasis on meat and dairy inspections and clean communities, and the city sponsors these great cleanup days. So we have like these Dutch girls out cleaning off the Marcus Daly statue, because I'm not quite sure why that, because it made a great image. But the meat and milk inspector reports are massive for those time frames. 1930 to 1940, you're dealing with childhood paralysis. I think we're all dealing with that a little bit now, aren't we? They closed public schools, they halted Children's Day at the gardens, and they started to talk about when schools would open. They didn't want anyone coming together. Public pools were closed, camps were closed, and they started looking at how to get infant paralysis under control. Yay, vaccines and antibiotics and good and better treatments for diseases are evident in the 1940s and 50s. And they would have huge vaccination days at the health department, like at the Civic Center. And thousands of kids would come. I wonder what they picked up that day. But many health issues went away in the 40s and 50s that we, thank God, don't have to deal with. One of those, smallpox, you rarely hear of that any longer. They continue to actively track vital statistics. They take public sanitation, and they do their meat and food inspections. In the 60s and 70s, they start looking at not just what's going on the streets, but looking at people's individual habits. And so they start non-smoking campaigns, and they're dealing with family health, environmental and work and industrial waste issues are coming to the forefront at that time. OSHA becomes enacted, and the health department works on workplace safety, and that is clear in their records. Of course, in the 1980s and 1990s, Superfund designation brings the health department into the arena to address the environmental issues on health of men, women, and children. They work with the CDC on measuring lead and arsenic levels in children. They remediate yard soil and attic dust in homes. And today, the Health Ordinance and the Health Department continues its impressive service to the people of Butte Silver Bow. This is a picture of Karen's annual report, comes from a printer, and it documents all of the activities that she has, which I'm so delighted we have that in our facility again. And the health department has really expanded on its educating the public on health issues. It monitors environmental concerns. It provides attic and soil abatement, food and consumer safety services. They do immunization programs, and they provide services for women, infant, and children, and well child screenings. They work with disaster and emergency services, public health nursing, and thank you. You do a great job. And so that is it for me. The health department has offered to do flu shots for anyone who need one today, which I'm recommending everyone get one. It's the 100th anniversary of the Great Flu. And last year, the flu was devastating in this country again. So get your shot. And we're thrilled that they came to be with us today. Does anyone have any questions? Yes, Lucy.
I was wondering about, you said in the water in the 1800s. Where did you get their water way back then?
The molten reservoir?
Oh, yeah.
Was piped down through, and you know, really, W.A. Clark, you know, I wasn't very nice when I said about the ladies. W.A. Clark provided the very first drinking water in our community. And it was really important because they immediately contaminated the water. And we have very little water here to begin with because we're at the top of the divide. So the molten provided the drinking water, and by 1890, our water came out of the big hole. It's an amazing engineering feat, getting that water off the big hole up over the Continental Divide. Really an impressive feat. But W.A. Clark provided the first drinking water. He charged for it. Does anyone have any other questions? Yes, Kim.
At the risk of being accused as a plant. So in my family, my great-grandfather was diagnosed with tuberculosis, or they said he had tuberculosis, but it was really silicosis from working in the mines. Was that common to say, no, it wasn't, miner's con, because they could treat TB or something, like out at Galen?
Yeah, they wouldn't want to compromise the companies.
Yeah.
They would call it tuberculosis.
So I wondered if maybe those high TB figures, or some of them.
Oh, it's all silicosis.
Was all, okay.
And you know, really, the Trades and Labor Union took on the health department and asked them not to, they didn't want miners to get chest x-rays. So if a miner would go in and be sick, and this even happened up into the 1950s, if a miner got sick, the trades and labor organizations would say, oh, don't get an x-ray, because if you get an x-ray, they're not gonna let you go to work. And it really was it's a fine line. Horace deals with it from a health standpoint. He deals with his peers. He sends nasty letters to all of the other doctors saying, as these men are coming into your office and are sick, you should not let them go back underground. But, you know, economics, they just didn't work. All right. Yes,
I have
Lucy.
another question. Of all these doctors that did so much, how many of them stayed in Butte and died, or did they leave Butte before?
Whitford, all of these health officers literally stayed here and died.
Or did,
Here, Freud and Murray, yeah. Those early ones did. They were able to practice the kind of medicine that was fabulous medicine. A lot of doctors pretty much stayed. A few would transitory in and out. You know. But even, you know, like Dr. Carolyn McGill, even though she had her big ranch outside of, down in the Gallatin Valley, the 360, she practiced medicine here until she retired. She never practiced medicine anywhere else. Yeah. She founded the Museum of the Rockies. She had all this stuff. She asked the university administration if she could use a Quonset hut on the side, and she moved everything in. So really, she is a remarkable woman as a physician and as a woman, and really contributing to the cultural heritage of the state, because the Museum of the Rockies really is her, it's her baby. Yeah. Okay.
very good, Ellen.
Well, thank you.